Hi and Assalamualaikum. My name is Muhammad Farid bin Rizwan from Group 1. Besides me, there are Afirah Habibah binti Husaini, Harizatul Nadia binti Abdul Rahman, Muhammad Fakri Syabani bin Muhammad Nasir, and Muhammad Afif Iman bin Suhaizi. Our group will be presenting Paseklam in chronic kidney disease prediction by using principal component analysis and binary logistic regression. Long-term renal dysfunction caused by chronic kidney disease, CKD, results in impaired kidney function. It's a prevalent disease that's commonly linked to growing older. CKD is also known as Paseklam or PCC, since it is one of the parts in the kidney that can lead to CKD. The PCC happens when the urine is having a tract infection. According to WHO, CKD, commonly known as chronic kidney failure, the kidneys progressively start to lose their functionality in this situation. CKD is a massive public health problem. PCC is the most neglected chronic condition in kidney disease, according to some experts. The causes, signs, and cause of renal disease have an impact on public health policies worldwide. Ethnicity, gender, region, and lifestyle all have a factor in kidney disease risk. The purpose of this study is to conduct research to identify the significant variables in predicting kidney disease by using principal component analysis, PCA, and binary logistic regression, BLR. The research objectives of this study are to investigate which variables are most highly correlated and influenced towards Paseklam disease, and secondly, to find the most significant factors affecting Paseklam disease. There are two research questions in the study. It will be conducted to answer these following questions. Firstly, which variables is highly correlated to Paseklam disease? And secondly, what are the most significant factors to be included in the model? The results of this study will be demand importance to the following. The findings of this study can be used to guide the department from the health sector in constructing the effect of kidney disease. Furthermore, this research may also give benefit to the community, especially people that are having chronic kidney disease. This research will assist the population in taking extra precautions to protect their health from all sources, regardless of whether they are young or elderly, male or female. More education will be provided to the community. The data is a secondary data obtained from Kaggle website. The study is about prediction of patients whether they have risk in chronic kidney disease. 25 features were included in the data collected over a 2-month period in India. As example, red blood cell counts, white blood cell counts, etc. The classification, which can be either CKD or not CKD, is the target.
Assalamualaikum. My name is Muhammad Afif Iman bin Suhaizi, and I will continue with Chapter 2, Literature Review. For the overview of the study, a progressive loss of kidney function is defined as a chronic kidney disease, which means the longer someone has diabetes, hypertension, or heart disease, the greater the risk of the kidney disease developing. The increased risk is primarily caused by the higher rates of the diabetes and hypertension in this population. The higher frequency of the chronic kidney disease in India is due to the number of factors. Chronic kidney disease, which is a chronic interstitial nephropathy with insidious onset and sluggish progression, is prevalent in part of the state of Andhra Pradesh, Odisha, and Goa. For the principal component analysis, they also use a lantern component model to reconstruct the missing data. Furthermore, a member of the author, Vaibhav Mohan, created a way for using decision tree that combine ID3, which is based on the information gain ratio, and algorithm, which are based on the fitness proportional and order selection approaches. Heuristics are frequently used by the algorithms such as ID3 to find short decision tree, although the obtaining the shortest decision tree is tough optimization problem. They use KPCA for feature reduction, and it is limited by the possibility of losing important feature due to selecting the top percentage of the principal component from the primary space.
Assalamualaikum warahmatullahi wabarakatuh. My name is Harizatul Nadia binti Abdul Rahman. I will continue based on literature review, which is binary logistic regression. So based on Umamesh, cardiovascular disease appear to be the leading cause of diabetic mortality, accounting for half of all diabetes-related deaths. The variables included in the study were socio-demography and hereditary risk factor, baseline diabetes duration, HbA1c, and time of onset of CVD, which is a cardiovascular, and its risk factor. The percent use method was used in the study is to determine the incidence rate of cardiovascular. Next is study by Krishna Prasad Akarya in 2022. The study is to analyze the correlation between the possibility of renting garment in the future and the elements that influence clothing rental. And in this paper is to minimize correlation between elements and prepare for logistic regression analysis, which is the researcher first use the factor analysis to classify the factor that affect customer intention to rent clothes, and then use the logistic regression algorithm properly forecast that 146 out of 275 consumers are unlikely to rent clothes. Next, in the study by Ignacio Garcia Dover is to determine the timing of the causative drug removal affect the prognosis of patient with toxic epidermal necrolysis, ET10, or Stevens-Johnson syndrome, STA680. And then the study by Barakat Tessema Zaud and Hidus Mescali is to analyze and identify the key factors that affect student academic achievement. The variable in the study could include the type and location of secondary school attendance, the type of admission, the level of talent of interaction, life and university, study habit, the economic and educational background of parents, reference and textbook availability in a university, student placement by their first choice, and study time example. So academic achievement is the dependent variable with two binary outcome, and the other variables are type of predicted variable. When other model components are accounted for student, the result of binary logistic regression show that the student will study more than 48 hours or 5. So based on the Barakat Tessema, how the student affect to the cardiovascular disease. Next, the summary of literature review based on the PCA and the binary logistic regression. There are many factors that can lead to pulse cell clump in chronic kidney disease, and according to the research article, there are numerous ways to accomplish this research study. For instance, the problem can be solved in many ways, such as principal component analysis and binary logistic regression, and it can be concluded that method can be solved in any kind of situation, especially in chronic kidney disease.
For Chapter 3, figure shows a flowchart for the analysis process. The first step in the research study is collecting the data from a website named Kaggle. Next, pre-processing has been done to check the outliers and missing value in the data. After that, model assumption testing is done to check whether the data has multicollinearity, dependent variable, and correlation so that it can meet all of the requirements to construct the method in the study. After all the assumptions meet the data requirement, the data will be analyzed using the method principal component analysis and binary logistic regression, and the result shown and based on its interpretation will be made. For data description, this study is based on secondary data obtained from Kaggle. The data was collected during a 2-month period in India. The classification, which is either CKD or not CKD, is used to determine whether or not a patient has a chronic kidney disease. There are 120 observations in all with 5 quantitative and 3 qualitative variables. Data preprocessing is a technique for converting the raw data into a clean dataset. For missing value checking, the term MV refers to data values that are not saved for a variable in an observation. There may be a missing value in the dataset if the total count of the value is not equal to the total number of observations. And for the outliers checking is a data point that differs significantly from other observations due to its anomalous distance from other values. Next, for assumption checking, first is missing value. In this report, the best way to check missing value is by doing eliminate to the data. And the second one is dependent variable. And in this study, the dependent variable will be PCC, since PCC is one of the cell sources of chronic kidney disease. At the same time, the outcome for PCC is 1 for present and 0 for not present. The third one is for outliers. So, to reduce the data variables, outliers can be treated by using imputation. The fourth one is correlation. It's used to determine how strong that the relationship might be. Since the study want to conduct a PCA, we need to make sure that the data has a strong positive relationship between two variables. And the last one is multicollinearity. To test multicollinearity in SPSS, tolerance value must be greater than 0.2 and the VIF must be lower than 10.
PCA is a statistical approach that enables to summarize the information contained in huge data tables using a smaller collection of summary indices. PCA is also concerned with explaining the variance-covariance structure of a set of variables. The purpose of PCA is to reduce a huge number of variables to a small set that retains the majority of the information in the large set. Its approach allows in building and use a smaller set of variables known as primary factors. In addition, it also generates a data visualization that reduces residual variance in the least squares sense while maximizing the variance of projection coordinates. If the correlation between the variables is strong enough, component analysis can be performed according to Bartlett's test of sphericity. Only the factor analysis can be performed if only HO is rejected. Additionally, the Kaiser-Meyer-Olkin or KMO test evaluates the data's suitability for analysis. It gauges the suitability of sampling for each variable in the model as well as the whole model. Generalized linear models are a class of models that includes logistic regression. BLR is a regression model where the target variable is binary, that is, it can take only two values, 0 or 1. It is the most utilized regression model in readmission prediction, given that the output is modeled as readmitted 1 or not readmitted 0. The Hosmer-Lemshow test is a measure of the goodness of fit for logistic regression, particularly for risk prediction models. The difference between the anticipated and actual success rates is shown in a classification table, or also known as a confusion matrix.
Chapter 4 for result and analysis. In the descriptive statistic, we use two types, which is histogram and the pie chart to indicate the variable. So under quantitative variable, which is age, PCV, hemoglobin, BP, and RC, we use histogram, and for qualitative variable consists of three variables, which is PC, PCC, and cut, using a pie chart. So for the histogram of quantitative variable for age, the histogram for age is skewed to the left, which is mean the variable is negatively skewed, and for the PCV also shows is skewed to the left. For the hemoglobin also show that the skew is to the left, which is negatively skewed, and BP also shows skewed to the left, but for the RC only show that the histogram is not symmetry, since the histogram doesn't have any skew. Next is pie chart of qualitative variable for variable PC, PCC, and the CAD, cardiovascular. So in this pie chart, we use two color, which is blue and green. So for the pie chart for PC, the blue color is the pie chart represent abnormal, and the green one is represent normal. The data reveal that the normal has a bigger proportion than abnormal in PC. And for the PCC, the blue one is represent the not present, and the green one is represent present. And the data reveal that not present in PCC has greater proportion than not present And for the cardiovascular, the blue is represent for no, and the green is represent for yes. The blue has a more proportion than the green one. So based on these three qualitative variable, means that only in this PC shows that green has a more proportion than the blue one.
From the descriptive statistic above, it shows that there is different sample since the data has a missing value for each of the observation. Therefore, there will be imputation needed for both quantitative variable in the study since the total observation has 120. For the frequency table for qualitative variable, the total observation that have is 120 for each of the variable. Therefore, there will be no imputation done for the qualitative variable. Besides, the variable for normal in past cell is greater than abnormal. Next, the variable in past cell clump for not present has the higher percentage compared to no present. Lastly, the percentage of no coronary artery disease also is higher than the number of percent in yes coronary artery disease. For the descriptive statistic above, we can see there are 120 valid value for the variable. The minimum value for hemoglobin is 4.8 and the maximum value is 17.8. The mean value is 12.478 for packed cell volume. The minimum value is 14 and the maximum is 54. The mean value is 37.82 and the standard deviation for hemoglobin and packed cell volume are 2.8440 and 8.830 respectively. It means the data relatively distributed near of the mean value. A negative value for hemoglobin and packed cell volume in skewness is negative 0.281 and negative 0.218. Indicate a great number of large values. Since the skewness is less than negative 1, we can say that the data are highly skewed. A kurtosis for hemo is negative 0.443 and for packed cell volume is negative 0.228, which indicate a distribution which is more peak than normal. Since the kurtosis is less than 0, then the distribution is light tail and it is also called as platykultic distribution.
Okay, now we move on to the principal component analysis part, PCA. Based on the table, KMO value is 0.603, which is more than 0.6. Thus, the data is suitable for factor analysis. So, based on this table, we reject H0, which is correlation is an identity matrix, since the p-value is lesser than alpha value, which is 0.05. Okay, next table is correlation matrix. Each cell in the table shows the correlation between two specific variables. It shows that the correlation between PCV and hemo is 0.81, which indicate that they are strongly positively correlated. Next, we can see that the correlation between RC and hemo is negative 0.427, which indicate that they are weakly negatively correlated. Okay, next, for the table commonalities, the results suggest that the best factor in explaining variation are hemo and PCV, since the factor have more than 80% value or commonalities. Okay, next, the table of total variance explained. There are two factors extracted. The first two eigenvalue are 2.356 and 1.213 because the lambda value is more than 1. The cumulative percentage is 71.381% of the total variability in the excitation data. Okay, next, for the pre-plot, we can retain PC1 and 2 since the eigenvalue is more than 1. PC1 and 2 are enough to describe the data. Okay, next, last part in the PCA part, which is component matrix. The cut of factor loading is 0.6. So this study will have two factor, and the factor will be factor 1, which is HEMO and PCV, factor 2, which is H. Okay, next we move on to the binary logistic regression, BLR part. From the figure, there are 120 observations in the study. Okay, next, variable in the equation. So based on the calculation, 769 observation will present a pass cell clump, while the other 4231 observation will not present a pass cell clump. Okay, next, the odd of getting PCC 16 sets, while the other 104 do not set the PCC. From the figure also, the accuracy of the data in classification is only 86.7. Next, for the omnibus test of model coefficient, the chi-squared value is 45.903. At the same time, the test has also 0.01 significant value, which is less than 0.05. Therefore, it can be concluded that there is a significant relationship between the dependent and all the set of predictor variable. Okay, next, so for the model summary, 58.4% of the total variation for PCC is explained by all the predictors variable. Another 41.6% is explained by the other factors. Okay, next, for the Hosmer and Lemieux test, alpha is equal to 0.05. Then reject Hesnal if p value is lesser than alpha equal to 0.05. Since the significant value is 0.962, which is more than alpha 0.05, we accept Hesnal, which is the model is fit. Okay, next, for this table, for this graph, the Hosmer and Lemieux test show the model is fit. However, the classification plot indicates the model is not good as the distribution does not scatter around 0 to 1. Okay, next, for the variable in the equation table, there are two significant variables in the study since the alpha is less than 0.05. So the logic equation will be presented as below. Okay, the last part in binary logistic regression, based on the classification table, we can calculate the apparent error rate, overall success rate, sensitivity, and specificity rate.
The overall conclusion from the analysis, we can say that the model is fine, but some aspects may need to be improvised in order to have a better prediction. And for the recommendation, different methods other than imputation can be used to cater to the outlier problem. Different techniques can be used to predict the outcome and compare the model to pick the best one. New data should be included as well. In the future, something big might happen that could disrupt the normal pattern of the outcome. For example, is COVID-19. Make sure to include new variable in the constructing model, as the new variable might become the significant factor in determining the outcome. Thank you, that's all from us.